Hi, my name is Nancy Bartlett. I'm a family nurse practitioner student at United States University, and today is December 14th, 2025. I'm going to do a quick 360 just to show the room. We are in an actual patient room, so there will be some of their things on the walls, but there is nothing written on them. There's another sign there that's in the room there, but that is my Snell for the exam. Back to where we started, we'll do the ceiling and the lovely call don't fall sign and the floor. I'll also show my table of all of my things. I am going to use some hand gel. So my hands are washed and clean. My equipment is clean and ready. Just to get some paperwork out of the way before we get started, I just want you to understand that this is a recorded head-to-toe exam that will be uploaded to YouTube for educational purposes. Do I have your verbal consent?
Yes.
Okay, let's get started. Let me adjust that really quick. That's better. All right, so just for educational purposes, we are only going to use initials, but can you give me your initials and a fictitious date of birth, please?
JB 10/3/63.
Great. And can you tell me what you're here for today?
My exam, annual,
Okay. And when was your last annual exam?
about a year ago.
Okay, great. Can you tell me a little bit about your, well, first, can you tell me where we are?
We're at the office.
Okay, great. So patient is alert and oriented, times 4 to person, place, time, and situation. A patient is also dressed appropriately, well groomed, and does not appear in any kind of distress. And speech is clear. So can you tell me a little bit about your past medical history? Do you have any chronic diseases like hypertension, high cholesterol?
No.
No? No cancer or anything like that? Okay. How about hospitalizations? Have you ever been hospitalized, had to stay in the hospital more than 24 hours?
No.
Have you had any surgeries before in the past?
No.
No. Have you ever had a colonoscopy?
Yes.
When did you have that done?
When I was 50.
Okay, great. How about immunizations? Have you had any, like the flu vaccine?
Yes.
When did you have that?
September.
Okay, great. And how about COVID vaccine? Did you have both COVID shots?
Yes.
And when did you have those?
During COVID.
Okay, and how about the booster?
This year.
Okay, great. And how about a prostate exam? When was your last prostate exam?
Last year.
Okay, great. Do you take any medications?
No.
Okay. Do you use any vitamins?
No.
Any herbal supplements?
No.
Any over-the-counter?
No.
Do you have any allergies to medications?
No.
To food?
No.
What about to environmental allergies?
No.
Okay. How about if you don't mind, talk about your family? If we could look at some family history. Your grandmother on your mom's side, is she living?
Deceased.
Deceased. At what age did she pass away?
83.
83. And did she have any chronic health conditions? Cancer?
No.
No. And do you know what she passed away from?
Natural causes.
Okay. And how about your grandfather on your mom's side?
78.
He was 78. Is he still living?
Deceased.
Okay. And what about him? Did he have any chronic issues? Any hypertension, high blood pressure, high cholesterol, diabetic?
No.
No. No cancer either?
No.
And he also, you said, passed away from
Natural causes.
Okay, and how about your grandmother on your father's side? Is she still living?
Deceased.
Okay, do you know at what age she passed away?
74.
74. Okay, and did she have any chronic health issues? Any high blood pressure, any hypertension, high cholesterol, any diabetes, cancer?
No.
Okay, how about your grandfather on your dad's side?
He was 78.
Okay, and do you know what is he still living or deceased?
Deceased.
Okay, and do you know what he passed away from?
Natural causes.
Okay, did he have any health concerns, chronic conditions? Again, the diabetes, high blood pressure, high cholesterol?
No.
No? No cancer that you know of in your family? Okay, and how about your mom? How old is your mom?
83.
83, and is she living or deceased?
Living.
Living, and does she have any health issues?
No.
Okay. How about your father? Is he still living?
Deceased.
Okay, and what age did he pass away?
70.
At 70. And did he have any health concerns that you're aware of?
No.
No? Do you know what he passed away from?
Natural causes.
Okay. Do you have any siblings?
No.
No siblings. Do you have any children?
No.
No children. Okay. How about, let's look at your social history. How about, do you live alone?
Yes. No, my wife. Sorry.
Yeah, you almost forgot about her, huh?
I did.
Okay, how long have you been married?
37 years.
Great. And are you two sexually active?
Yes.
Are you in a monogamous relationship?
For the last 37 years.
Okay. So, do you use any kind of protection or?
No need.
Okay. How about your eating habits? Can you tell me a little bit about them?
Try to eat a balanced diet. Fruits and vegetables, protein, carbs.
Okay. How about hydration? Do you drink water?
I do. I drink the bottled water and I usually drink 5 or 6 bottles a day.
Okay, great. And how about coffee? Do you drink coffee?
Usually have a couple of cups a day.
Okay. And are those the regular size cups?
6 to 8 ounce cup.
Okay, great. And do you use any kind of tobacco products?
No.
No. That would include you don't vape, you don't chew, and you don't smoke cigars either. Okay. How about alcohol? Do you drink any alcohol?
No.
Okay. How about recreational drugs? Do you use any?
No.
Do you exercise?
I do. I walk my dogs.
Okay.
Usually 4 or 5 times a day, about a half mile.
Okay, that's great. Do you feel safe at home?
I do.
Okay. And do you feel like you've had any recent stressors in your life? No. And do you have a religious preference?
Methodist.
And is that an important factor in your life? Do you attend church?
Yes.
And do you feel like church is a good support system for you?
Yes.
Okay. And if you were hospitalized, would you want us to call your pastor?
No.
Okay. And we're just going to go through a quick review of systems, if that's okay with you. Most of these are yes and no questions. So lately, have you experienced any fever, chills, fatigue?
No.
Okay. How about any drainage from your eyes, change in vision, blurry vision?
No.
Okay. Any drainage from your nose?
No.
No. Any trouble chewing? Any mouth sores?
No.
Any ringing in your ears or drainage from your ears?
No.
Notice any trouble swallowing?
No.
Okay. How about any chest pain?
No chest pain.
Any palpitations or fluttering?
No.
Have you noticed any lower extremity edema?
No.
Okay. And how about bowel habits? Have you noticed any trouble with constipation or diarrhea?
No.
Nausea or vomiting?
No.
How about urinary wise? Have you noticed any change maybe in your stream? Is it, do you like increase in frequency or hesitation? Any burning with urination? Any pain with urination?
Nope.
Okay, and no drainage that you've noticed?
No drainage.
Okay, and have you noticed any joint pain, stiffness, muscle pain?
Nope.
Okay, and any numbness or tingling in your finger or toes?
Nope.
Any dizziness?
Nope.
No. Any headaches?
No.
Okay. Have you noticed an intolerance to heat or cold, hot or cold?
No.
No. Noticed any lymph nodes that are swollen anywhere?
Nope.
Okay. How about any wounds that won't stop bleeding?
No.
How about any skin rashes, any itching anywhere, any change in moles, size? No? Okay. All right. I think that covers, any anxiety, mood swings, any kind of trouble with depression?
No.
Okay. That concludes our review of systems. The next thing that I want to do is I have 3 words that I'm going to tell you. And I want you to repeat them after me. Apple, penny, table.
Apple, penny, table.
And I want you to remember those 3 words because I'm going to ask for them again in just a little bit, okay? Can you tell me what high school you attended?
Franklin Academy.
Great. So remote memory is intact. If you were walking along the street and you saw an envelope laying there and you picked it up and you saw that it was fully addressed and stamped, what would you do?
Mail it.
Great. So reasoning and judgment is appropriate. The next thing that we're going to do is I'm just going to start with the assessment. And so the first thing that I'm going to do is I'm just going to stand up, hope that's okay. And I'm going to just take a look at your head. And the head is normocephalic and atraumatic. I see some anterior and posterior thinning of the hair, but otherwise it looks like normal texture. I just have a little guy here and I'm just going to gently go through your hair. And I'm going to come on the other side. So I don't see any flaking, I don't see any lesions, and I don't see any kind of infestations, which is a good thing. The next thing that I'm going to do is I'm going to just touch your nose if that's okay. And any pain along here?
No.
And up here?
No.
So nose is symmetrical. There is no tenderness noted at the frontal or maxillary sinuses. Also a good thing. I'm going to have you occlude one of your nostrils for me. And take a deep breath in and breathe out. And again on the other side. Great. So airflow is normal it's equal bilaterally. The next thing I'm going to do is I'm going to use my scope and I'm going to just take a look in your nose, okay? So the mucosa is pink and moist. The septum is midline and the turbinates are present. The next thing I'm going to do is I'm going to have you close your eyes. And I'm going to have you occlude one of your nostrils and take a smell and tell me what you smell.
Coffee.
Great. And go ahead and sniff again and tell me what you smell.
Nutmeg.
Perfect. Now occlude the other nose and take a smell from me again.
Nutmeg.
Perfect. And once again.
Coffee.
Perfect. That assesses the cranial nerve 1 olfactory, and it is intact. The next thing that we're gonna do is I'm going to take a look inside your mouth. So if you don't mind opening your mouth. So the lips are normal and symmetrical. The soft palate is also symmetrical. The mucosa is pink and moist. The tonsils are +2, and I don't see any exudate or lesions on those, which is a good thing. The next thing I'm going to do is I'm going to have you open your mouth and say ah.
Ah.
Great. So uvula is midline. That assesses cranial nerve 9 and 10, which is glossopharyngeal and vagus, and that's normal. I am gonna have you swallow for me. Swallow good. Again, that's assessing the same cranial nerves. I also have what would be a tongue depressor, and I am not going to do this to my patient because I am being kind, but for educational purposes, to assess that 9 and 10 again, that glossopharyngeal and vagus, I would use a tongue depressor. I would gently touch the posterior pharyngeal wall, which would elicit a gag reflex, which would be a normal response. The next thing I'm going to do is have you go ahead and stick your tongue out. And tongue is midline, which evaluates cranial nerve 12, which is hypoglossal. And I'm going to have you clench your teeth. That is maxillary and temporalis is normal. Can you go ahead and push your tongue? Yep. Muscle control is also normal, which also evaluates cranial nerves 9 and 10, the hypoglossal and pharyngeal. The next thing I'm going to do is I have 2 things here. So I have a paper clip, and I'm just going to show you. This is sharp, and this is dull. So we're going to be evaluating cranial nerve 5, the trigeminal. So I want you to close your eyes and tell me, is this dull or sharp?
Dull. Sharp. Sharp. Dull. Dull. Sharp.
So cranial nerve 5 is intact. The next thing I want to do is just have you, we're going to evaluate cranial nerve 7, which is the facial nerve. So I want you to smile big and puff your cheeks out and raise your eyebrows up. And so they are symmetrical, and that's a normal finding for cranial nerve 7. The next thing that I want to do is I'm just going to look at your eyes. I want you to look forward, and I'm going to come around to the other side. So I don't see any pitosis. I don't see any exophthalmos. The eyes are symmetrical. I don't see any kind of drainage. I don't see any lesions. Can you close your eyes for me? The lids are symmetrical also with no lesions. Can you go ahead and open up again? And I'm just gonna pull down gently. So the conjunctiva is pink, and the sclera is clear and not ecteric. Open your eyes wide. So the cornea is clear. The irises are symmetrical, and I don't see any opacity to the lenses, which is also a great finding. So the next thing that we're gonna do is we're gonna assess cranial nerve 2 optic. So I'm gonna have you stand up if you don't mind. We're gonna do a visual acuity. My sound test is back here, so Jamie, if you'll walk to the end of the stretcher. We kind of measured it out before the test, and prior to the test, this is about 6 feet. So if you would read, use the occluder to cover your eye, and if you would read the smallest line that you can, please.
LTFPH.
And cover the other eye.
LTFPH.
Okay, great. And then without covering either eye, and read the sign again.
LTFPH.
Great. So visual acuity is 20/20, which is a normal finding for that optic nerve. I'm just going to have you have a seat if you don't mind. If you don't mind sitting on the edge, would you? Perfect. Thank you so much. So the next thing that I'm going to do is I'm going to test peripheral vision or confrontation. So what I want you to do is just look at my nose and tell me when you see my fingers, okay?
No.
Great, so confrontation is present in all visual fields. The next thing that I'm going to do is also test convergence. Confrontation tests also cranial nerve 2 optic and 3 ocular. Convergence also tests cranial nerve 2 optic and 3 ocular, just like confrontation does. So what I want you to do is just look at my finger and just keep looking at my finger, looking at my finger. Great. So convergence is present, which is a normal finding. The next thing I'm going to do is I'm just going to take a look at your pupils. So what I want you to do is find a spot behind me, and I'm just going to look into your pupils. So first I'm looking with the light in the same eye, and now I'm going to shine the light in the opposite, in one eye, but look at the opposite. Great. So pupils are equal, round, and reactive to light and accommodation. That also tests cranial nerves 2 and 3, optic and ocular. The next thing I'm going to do is our vision test with the ophthalmoscope. All right, and so I'm holding the scope in my right hand, and I'm going to look in your right eye. Just remember, I am going to get nice and close. Okay. And back to the other side. So, red reflex is present bilaterally. I was able to follow the vessels to the optic disc, centrally to the optic disc. The optic disc has sharp edges. I was able to appreciate large, darker veins and small, lighter arteries. I was able to appreciate the macular is present, and the foveal reflex was also present. The next thing I'm going to do is I'm going to just take a peek at your ears, okay? And I'm looking at your ears, and I'm just going to touch them. Any tenderness?
No.
No, so the ears are symmetrical bilaterally with no tenderness. I am going to take a peek inside your ears. Let's start with this ear first. And I'm going to kind of take a look at this ear. So the ear canals are clear. I was able to visualize the tympanic membrane, which is pearly gray. I was able to see some landmarks of the malleus and umbo. The cone of light is at 5 o'clock on the right and 7 o'clock on the left. The next thing that I'm going to do is we're going to assess the vestibulocochlear optic nerve. And so so that's cranial nerve 8. And so first thing I'm going to do is a whisper test. So
Pink. Purple.
great. I should have explained that I was going to whisper and have you repeat what you heard. The next thing I'm going to do is the Weber test. So I'm going to bump this on my palm, and I'm going to place it on the top of your head. And what I want you to do is tell me where you hear the sound, okay?
Both ears.
Perfect. So Weber test is midline with no lateralization. The next thing we're going to do is a Rhine test. So what I'm going to do is, again, I'm going to bump this on my hand and I'm going to place it right behind your ear, right about here. And I want you to tell me when you no longer hear it, and then if you hear it again, okay?
No. No.
Okay. And we're going to do the same thing on the other side.
No. No.
Okay, so air conduction is greater than bone conduction, which is a normal finding. The next thing I want to do is I just want to palpate the temporal artery, the temporal pulse, just to see any tenderness.
No.
So no tenderness, I don't feel any thickening, feels like normal. I'm just going to place my fingers right here, and I want you to open your jaw and close your jaw and push your jaw out as far as you can. Yep, and side to side. So I don't appreciate any kind of TMJ. There's no clicking or anything noticed. So that temporal jugular, the temporal masseter TMJ is negative. The next thing that I'm going to do is I'm going to assess the spinal accessory cranial nerve, which is 11. And so I'm going to place my hands on your shoulders and resist when I press down. Great. So that's negative. Strength is equal bilaterally also. I'm also going to palpate the lymph nodes right now. So I'm going to start at preocular, and I'm going to move to postocular and occipital and tonsillar. Submandibular, mental, submental, and I'm gonna down here onto anterior cervical. And if you would turn your head just slightly. And that's posterior cervical. Again, posterior cervical. And then subclavicular. And I'm going to move on to the epitrochlear. And then I'm going to palpate the axillary starting medially and moving anteriorly, and then laterally, and then posteriorly, and again on this side, epitrochlear, and I'm going to start medially, anteriorly, laterally, and posteriorly, and no lymphedema, lymphadenopathy noted in any of them. So that's a normal finding. The next thing I want to do is I'm going to just move on to the chest, and I'm looking anteriorly and posteriorly, and anterior to posteriorly, the diameter appears normal at 1 to 2. I see normal rise and fall. I don't see any use of accessory muscles, which is a normal finding. I'm just going to place my hands on your back. I want you to take a nice big deep breath in and out. So lung expansion is symmetrical bilaterally. I am going to use my hands and I'm going to place them on you. And every time I do, you feel me touch you like this, I want you to say 99.
99, 99, 99, 99, 99.
Great. So fremitus is found throughout, which is a normal finding. The next thing that I want to do is I want to percuss all the lung fields. So I'm going to start posteriorly. Right middle lobe, left lateral, and then I'm going to come and percuss anteriorly. And so resonance is heard throughout. The next thing that I'm going to do is I'm going to use my stethoscope, and I'm going to go posteriorly and listen to lung sounds with the diaphragm. So nice deep breath in and out, in and out, in and out, in and out, in and out. And I'm going to listen to that right middle lobe, left lateral, and I'm going to come around anteriorly, and again, nice deep breath in, great, and lung sounds are clear bilaterally. I don't appreciate any rhonchi, wheezes, stridor, crackles. I did miss palpation, so I am going to palpate the chest. Any tenderness anywhere?
Nope.
And I'm just going to palpate posteriorly really quick. And no tenderness. Okay. So no tenderness noted. Chest wall is normal. I don't, again, see any use of any kind of accessory muscles. So we're gonna move on to cardiovascular, and I'm just looking at the anterior portion of the chest, and again, I don't see any unusual symmetry. The chest is symmetrical. I don't see any pulsations or heaves. So the next thing I'm going to do is I'm going to palpate the pericardium, the precordium, sorry. So I can't appreciate any abnormal thrills or pulsations present. Next thing I'm going to do is I'm going to take my stethoscope and I'm going to listen to the carotid arteries with the bell, listening for any kind of bruit. So no bruit noted. If there were, of course, I'd want to grade it with frequency, timing, pitch, and location. I'm going to palpate one at a time. And the carotids are +2 bilaterally. I'm going to have you turn your neck slightly, just slightly. There you go. And again, the other way. I don't recognize any jugular vein distension either, which is also a normal finding. The next thing I'm going to do is I'm going to take my stethoscope again and I'm going to listen to the chest first with the diaphragm. And I'm going to begin on the right second intercostal space at the aortic. Second intercostal space on the left, pulmonic. Third intercostal space on the left, Erb's point. Fourth intercostal space, pulmonic. And mid-clavicular fifth intercostal space, mitral. And S1 and S2 are present with regular rate and rhythm. I don't hear any extra heart sounds, gallops, or anything like that. I do need to palpate the point of maxillary impulse, which is also at that mitral point, the fifth intercostal midclavicular line, and it is present and normal. Next, I'm going to listen again with the bell at the same points. So again at the aortic. Pulmonic. Erb's point. Pulmonary. And mitral. And again, no bruits appreciated. Jamie, I am going to have you turn and lay back. And I'm just going to lay you back. And I'm going to listen to all those points again. First with the diaphragm. And then with the bell. And again, they're unchanged, so that is a normal finding for the heart. And since you're already laying back, we're going to go ahead and move on to the abdomen. And so I'm just going to pull your shirt up if that's okay. And we're going to take a look. I'm just going to inspect, and the abdomen is flat and round. I don't see any pulsations. I don't see any lesions. I don't see any scarring, which is a normal finding. The next thing I'm going to do is I'm going to oscillate all 4 sounds. So I'm listening with the diaphragm. And vowel sounds are normal. The next thing I'm going to do is I am going to percuss in all 4 quadrants again. So timpani is heard throughout. I'm also going to percuss on the the bladder, and it's also tympanic. However, if I heard dullness there, that could indicate distension. I'm also going to percuss at the spleen, and this is Traub space, which is also tympanic. And go ahead and take a deep breath in for me. That is Castell's point, and it is also tympanic, which is also a normal finding. So indications of no enlarged spleen. The next thing I'm going to do is, I'm just going to close up just a little bit so I can see my landmarks. I have a ruler here, and I am going to palpate up through abdominal tympani till it becomes dull. And then I'm going to palpate down until resonance is no longer heard, and that space should be 8 to 10 centimeters, which is a normal finding for normal liver. Next thing I'm going to do is I'm going to palpate the abdomen. And Jeannie, are you having any abdominal pain today?
No.
Great. So I'm going to start with light palpation. And you just let me know if you have any tenderness anywhere. Great. So no tenderness. I'm going to next use deep palpation. Let me know again if there's any tenderness anywhere. No tenderness? Okay, great. I could not appreciate any masses either. The next thing I'm going to do is I'm going to find on the right side under about mid-costal area, I'm going to palpate. I want you to take a deep breath in and let it all out. And I can feel the edge of the liver. It is smooth and feels of normal size, which is a great finding. Next, I'm going to palpate the spleen. So again, I want you to take a nice big deep breath in and let it all out. And I can't appreciate any splenomegalia, so that's also a good finding. If I were going to assess any kind of ascites, I would want to do a wave and peristaltic and wave test on the abdomen to see if there was any ascites. So that's a normal finding, which is great. So the next thing we're going to do is musculoskeletal system. So would you mind sitting up again? Great, I'm just going to get this chair out of the way. And since I have your arms right there, the first thing that I'm going to do is I have 2, and just place them right here in your arms if you don't mind. I have 2 Q-tips, and I'm going to touch you once or twice. And I want you to tell me if it's 1 touch or 2 touch, but I want you to do that with your eyes closed, okay? Ready?
2, 1, 1, 2.
So 2 touch discrimination is intact. Can you turn your hands over, well, quickly, over, and do this? So rapid coordination is intact. I want you to take your heel and run it all the way down your opposite leg from knee to ankle. Perfect. And again, the other way. Perfect. And the other thing that I'm going to do is I'm going to hold my finger out, and what I want you to do is touch my finger, touch your nose. Ready? Touch my finger, touch your nose. Touch my finger, touch your nose. Touch my finger. Right, and we're going to do it again with the other hand. Touch my finger, touch your nose. Touch my finger, touch your nose. Touch my finger. Perfect. So finger to nose, toe to shin coordination is intact. I do have an object here that I'd like to place in your hand, and I'd like you to close your eyes, and I'd like for you to tell me what that object is.
It's a key.
Perfect. And keep your eyes closed, and can I have that palm back? And I'm going to draw something in your palm. Can you tell me what it is?
3.
Perfect. So stagnosis and graphesthesia is present. The other thing that I want to do is I just want to make sure that you can differentiate between sharp and dull. So you're going to close your eyes for me, and once again you're going to tell me sharp or dull. So again, I want you with your eyes open. This is sharp, this is dull. All right, ready?
Sharp, dull, dull, sharp, dull, sharp, sharp, dull.
Great. So sensation is intact to both upper and lower extremities. Could I see those hands, please? And go ahead and turn them over for me. And your nails. Look at this one. Nails are nice and smooth. I also don't see any clubbing or any cyanosis. The next thing I want to do is I'm just going to take a joint, and I want you to close your eyes and tell me which direction your finger is going.
Down, up, up, down,
And on this hand again.
up, down, up, down, down, up.
Great. And if I could see one of your feet, please. Can you tell me which way this is going?
Up, down,
Great. And again.
down, up.
So joint position is also present. I want you to close your eyes, and I'm gonna actually have you put your feet up here just for the camera so we can see. I'm gonna bump this on my hand, and when I do, I want you to close your eyes, and I want you to tell me if you feel a vibration.
Vibration, vibration.
Perfect. So vibration sense is also present. The next thing that I'm going to do is I'm going to assess deep tendons. I'm going to start with the bicep. Great. And I'm going to do bicep over here. Great. And this is tricep. Great. And again over here. Great. And then I'm going to assess brachioradial, radialis. Okay. Over here. Okay. And I'm going to assess patella. And if you don't mind scooting back just a little bit so your legs will, there you go, perfect. And then Achilles. Great. Deep tendon reflex is present. Bilaterally, they're equal. The next thing that we're going to do is I'm going to have you stand, if you don't mind. And I'm going to have you turn, and I'm going to have you bend over. Okay? just gonna lift your shirt, and what I'm looking for is spine symmetry, and the spine is symmetrical and it's in line. I see normal curvature of this lumbar, thoracic, and I see no lordosis, lordosis, scoliosis, or kyphosis. The other thing I'm going to do is I'm going to check the Babinski. Great. So Babinski is present, and that's a normal finding. I'm going to have you lay back really quick. I did not check Murphy and McBurney's on your abdomen. So I'm going to have you take a deep breath in and let it out. Any pain? Okay, and that was Murphy's testing for gallbladder. And again, take a deep breath in and let it out. Any pain? That's McBurney's, that's testing for appendix, and so both of them are negative. So I'm going to go ahead and have you stand again. And let's check grip strength. So grip strength is 5 out of 5 bilaterally. The next thing that I'm going to have you do is, we're going to go ahead and stand if that's okay with you. And we're going to check range of motion. So the first thing that I want you to do, that's fine. I'm going to stand on the other side of the camera just so we're both in screen. So what I want you to do is raise your arms all the way above your head and back as far as you can. So that's shoulder flexion and extension. And I want you to raise them up to your side and cross them across your body and back out and back down. So that's shoulder abduction and adduction. I want you to put your arms out and elbows in and elbows back out. So that's elbow flexion and extension. Wrists up, fingers apart and back together. That's finger abduction and adduction. Down and up, that's wrist flexion and extension. And if you can go sideways with your wrists, yep, that is wrist abduction and adduction. And I'm gonna put this side rail up for safety. And if you mind holding on to that, I want you to fully extend your leg forward and back as far as you can go. Great. And again with the other leg and back. So that is hip flexion and extension, and if you can take that leg and go to the side and back in, and the other side and back in, that is hip abduction and adduction. And if you'll bring your knee up and straighten it out, and while we're there, point your toes to the sky, yep, and all the way ballerina point, perfect. So that is knee flexion and extension and dorsal flexion, dorsal and plantar flexion. And again with the other one, knee up and bend your knee and leg out and toes to the sky and point them straight out. Again, knee flexion and dorsal flexion. Those are 5 out of 5, they're symmetrical. The next thing that we're gonna do is I'm gonna come around and we're gonna test strength. So if you'll put your arms straight out and resist me, I'm pushing, and so that's deltoids, arms in front of you. I'm going to pull and push. So that's biceps and triceps. Fingers out, resist me putting them together. That's finger abduction. I'm gonna have you sit again because it's just easier. So I'm gonna put my hands on your thighs and push back and push against me, and one more. So that's hip flexion, abduction, and adduction. I'm going to push against your shins, and yep. And now your feet, like you're pushing on the gas pedal, and now resist me. So that was quadriceps, hamstrings, and dorsal and pedal, and that is also 5 out of 5, which is a normal finding. I'm going to have you stand, and we're going to do a couple of special tests. So what I want you to do is put your arms out and thumbs down. Arms out, thumbs down. Yep, and I'm gonna bring them in, yep, right about there at a 30, 40 degree. I'm gonna push down resistance and I want you to resist. Any pain or discomfort? No. So that is a negative empty can test. Hands at your side, close your eyes. That is a negative Romberg's test. And the last thing I want you to do is up like you're holding bowls of soup. Yep, close your eyes. No pronator drift. So that's also a normal finding. The last thing that we're gonna do is we're going to assess your gait. So walk forward for me and turn around and walk back. So gait is smooth and coordinated and symmetrical. I want you to do like a tightrope walk, so toe to heel, and tandem walking is present. And I'm just gonna think quickly to make sure that we covered everything, and I do believe we did. Jamie, thank you so much for doing this with me. That concludes our toe, head to toe.